Let's talk some sports medicine and bring in our good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Joe, good morning. What do you have?
Hey, Ray. How you doing today?
I'm doing terrific, man.
Great. That's great. Yeah, this is great weather and a lot of fun. And I'm going to move away from the group I normally talk about as my younger athletes and high school athletes, just because I've had a couple of recurrences of this unique injury I've seen through my career. So in a career of 35-plus years, one of the unique injuries that I've seen, and I get more calls on this injury probably in my career than almost any other injury I've seen. So I kind of just want to explain it. Have you ever heard, you're so good with injuries, of an injury that's known as tennis leg?
Tennis leg? No. The elbow, yes, not the leg.
So we love to put these names on, sport names and other names. And I know you've probably heard this from people in our age range, but maybe not known of it as tennis leg. It's a unique injury, and this falls in the category of when sports injuries aren't always from sports. They occur from other things that adults do. The source, again, of probably the most calls of my career. I really wish you hadn't given my cell phone out 20 years ago, Ray, because so many people are calling on these things. And I'm joking about that. I don't mind, and people call me about injuries. But this is one that people are really distraught when they first get the injury. It occurs most in the ages of 30s, 40s, 50s. We don't see it much after 50s. We don't see it much before 25 ever. But it is when athletes push off really hard with the lower leg. They're really trying to get behind something and push hard, and they will feel a pop. And they get intense pain in the back of the leg, in the calf area. And it is so universal. Everyone says, I felt like I got kicked, I got shot, I felt this pop in the back of my leg. And, of course, one of the first things people worry about is, did I tear the Achilles? And Achilles tendon tears in in the adult age range is problematic. Because if you get an Achilles tendon tear, we have to go through the issue of should I have surgery? If I don't have surgery, or even if I do, I may really lose the power generator of pushing off forever again. And so Achilles is a problem, but luckily this injury is about 4 times more common than Achilles injuries. It's not down at the base, down where the Achilles attaches to the heel bone, all the way at the bottom of the ankle. And many people go to emergency rooms or medical people to make an evaluation, make sure it's not an Achilles. And then they're just not sure what to do after that. And what happens, Ray, the weak spot in the calf muscle is where the big, strong calf muscle attaches to the tendon. Tendons attach muscle to bone, the tendon, and so it's called the muscle-tendon junction, about midway down the calf muscle, usually on the inside. About 5 to 1 of these will be on the inside calf muscle. They feel a pop. It swells immediately, very intense pain. They can't bear weight. They're really out of sorts when they call me because what the heck am I going to do? What is this? They're telling me it's not Achilles, but what is it then? And so this tear causes a lot of swelling and pain in the inside part of the calf muscle. And it is classically in sports, tennis players who would come to the net real hard, or in a basketball player, these 30s and 40s-year-old basketball games, somebody will be jumping or push off and they'll feel a pop and they need help getting off the court. Or, they told me it wasn't so bad in pickleball, but I saw and heard of a lot of pickleball injuries with tennis leg. So I think it occurs in anything where you're pushing off. But the funniest thing is, in my career of getting all these calls, I have gotten so many stories. I was cutting the grass and pushing my mower uphill. I was pushing the car out of the snow. My tractor got stuck in the mud, and I was pushing really hard, and I felt this pop. And I'm laying on the ground. I can't get up right now because of the calf muscle problem. Here's the good news. If it's not the Achilles, once that's ruled out, surgery's almost not necessary ever for tennis leg. It heals very well with the appropriate treatment. And so ace bandage, a heel lift in the shoe for a while, and some time with somebody for rehab and physical therapy helps get that muscle back to strength in about 3 to 6 weeks. And I see people later and they say, I'm doing so much better. I hadn't lost that pain generator. I got it back. I am so appreciative that you tell me, hey, that's not the Achilles. But this injury happens very frequently in 30s, 40s, 50s, and is known just one of those names we like, tennis leg, but it occurs in anything. So as an adult, the way you prevent it, you see everybody at those gyms working on the stretching machines. They're on the stretch boards. They're on the stairs stretching out those the calf muscles. Stretch your calf really good and avoid anything where you're really having to push hard uphill. Don't push that mower right uphill, straight uphill, and things like that when you can't, or when you don't have help pushing a car out of a ditch or something like that. You're going to end up tearing that Achilles, or you're going to end up tearing that calf muscle. But thankfully, most of the time, it's not the Achilles tendon.
Wow, that's good to know for sure. Joe, is that a wear and tear thing, or is that a sudden burst type of thing, or both?
A wear and tear thing, but it's just a watershed where the muscle and tendon meet. In other words, it weakens over time. It's just we're kind of a setup for that. And so it's much stronger in a kid in the teens and 20s, and then it just starts to weaken over time. And then when we get past age 50, we don't really have the power to tear it anymore. So this is my friends that are 30s, 40s, early 50s that they get this injury.
Way back then for both of us, right?
Oh, wait a second. You're right about that, right?
All right, Joe. We'll do it again next week. Thanks for the time and the visit, my friend.
Enjoy the good weather and the heat. Next week we might have to throw out some of our heat stuff. It sounds like we're getting in the heat zone.
I figured you'd be on that for sure, my friend. Thank you.